Hold on. Hold on. So I need to change gloves?
No. Just take it off.
Hold on. So I need to change gloves? Yeah, that's better.
Just take it off. Who's muting? Me. Wait, let me try one more time. I have to do it twice. There we go. Tell me to press me again.
You try again? It's not accepting.
Okay, we'll try one more. Nope.
No.
Okay, let's just go. All right, Nisha the PA, we are live.
Hi guys, it's Nisha the PA over here at Dr. Emer's office, and today I want to show you my gorgeous patient. Now, I'm going to walk you through what we were able to accomplish for her and kind of talking a little bit about some of the problem areas and how we were able to address them. This was a two-part surgery, so I'm going to go from the very bottom and go all the way up to the top and show you how we can cater to you and help you meet your goals, whatever they may be. Now, let's start off a little bit down below. Now, during the first part of her surgery, we wanted to give her a lot more definition to her calves, to her legs, give her a little bit of a V taper down below. So we were able to do that by doing fat grafting and of course doing kind of liposuction to the areas to make it look very well defined in that particular area. And then as we move up a little bit higher, you'll see what we were able to accomplish from the surgery we just recently did. Right now we did a full thigh lift or full thigh lift, which you'll be able to tell us there's a difference between doing a full and then a spiral thigh lift. You'll see right now with the full thigh lift that she has her incisions on the internal part or the inside of her thighs. It's kind of like taking the skin and pulling it very tight on the internal side and then tighten it up there and keeping it that way. Now normally with a spiral thigh lift, what we do is the incisions are actually just in the groin and we're able to take the skin and pull it up, and then the incision site is really well hidden here. But with the full, we were able to get a little bit better tightening by doing the full thigh lift. Of course, we're going to do our liposuction, our internal heating with Renuvion to really tighten the area. You can kind of see in her before, she had a little bit of irregularity to her thighs. You can see a little bit of bumps and lumps. And now take a look at her after. Look how nicely smooth out her thighs look now, how much more well defined they are. And guys, go a little bit higher. I want to tell you this, like that, it doesn't even stop there. It just continues to get better. Look above here. We were able to give her a lot more well-defined definition to her abdomen. Of course, you guys have heard me talk about it before. This is the liposuction. This is the internal heating with Renuvion. She already had a really nice shape, but we wanted to give her a little bit more definition, a little bit more smooth to her skin. So look, this is from the lateral aspect of her lateral sides. Look how much smoother it is now with the internal heating with Renuvion and liposuction. We were able to also do this to the back side. Now, of course, you guys can't appreciate that now, but we're going to get better. If you continue to follow us from her surgery until now and to her after photos, you'll really be able to appreciate we were able to do the liposuction to her back area. So all of this is nice and smooth. We were also able to give her a nicer appearance to her buttocks area by doing Selfina. Of course, Selfina is really great for those dimples, because what happens with cellulite is that they're held down, they're tethered down, and we have to really get in there and cut those little tethered pieces and then do the liposuction and fat grafting to get it nice and smooth.
All right, Nisha the PA, we have some questions here. People are asking, is she still swollen?
Now, of course, she just got out of surgery, so she's still swollen right now. So even though she looks beautiful right now, her results will only continue to get better and better as she continues to do her aftercare. Right now, she is doing her lymphatic massage. Now, of course, with the lymphatic massage, your body likes to accumulate a lot of fluid from surgery. So with the lymphatic massage, we're expressing that fluid out. You can see she's draining now. Essentially, what's going to happen over the next few days is that these will eventually come out. Her swelling is going to continue to go down because we're doing lymphatic massages, we're doing IV therapy, and then we're also doing hyperbaric, and all of those are aimed at expediting the healing process and decreasing the swelling rather quickly.
Nisha, we had a lot of people write in last night about our patients' scars and what they can do to treat them. Tell us how you can help them.
Now, there's a couple of different things we do in the office to make sure that not only do you heal appropriately, but your scars are super minimum and that no one can really notice them. Now, as you can see, this is from her previous surgery, so we were able to do Fraxel and V-beam to her scars. Look at this. This is just one treatment. Ideally, we recommend 3 treatments, 4 to 6 weeks apart, but this is just one treatment, and look how nice her scar looks. Now remember, that combination treatment is going to be Fraxel, which helps with the irregularity of the scar, helps it to be nice and smooth, and then V-beam, that helps to take some of that pink or purple out of the scar and get it to be a little bit more skin tone. In addition to doing lasers, we don't just stop there. We make sure you have the correct skincare. Now, skincare is going to consist of things like Silogen, which is going to decrease or minimize the risk of keloiding. You also have your anti-age serum, which is your concentration of peptide. You have your refit face, which is your concentration of amino acids. All of these will help the scars to heal appropriately, help them be super minimum. So at the very end of everything, where you're nice and healed and you have the results you want, you're barely going to notice any of these scars, guys. We make sure we take care of you from A to Z. Now, going up, we don't just stop at doing laser treatment for your scars, right? So when it comes to just overall skin health, to making sure she has this glow, we did Fraxel and, oh, our lights, come on now, there we go. We did Fraxel to her arms, her face, neck, and chest. We also did BBL. So Fraxel is not just for your scars, but we can do it all over to really help to resurface the skin, give you a nice brighter appearance. We also did BBL. BBL is an intense light that helps the brown spots come to the surface, and then they're going to eventually slough off, and she's going to have this nice, beautiful glow to her skin. That's the reason why you see a little bit of this freckling to her chest. That's just from the after effects of doing the Fraxel. That's going to go away because, of course, we're doing the skincare, and she's following all of our treatment recommendations. So let's start a little bit over, and so I can give you guys a really overview of what we did for her. And this time we'll start from the top and go down to the bottom, because we did the Fraxel, laser, face, neck, and chest. We also did arms. We did BBL. So she's going to get that nice glow. During her first surgery, right now we did the brachial. Look at this. We were able to move a lot of excess skin from her arms. So we'll show you some of her before photos. But look at this, how nice and tight this is. We remove that excess skin. We're doing lasering to these scars to make them super minimal. Look at that before. A lot of excess skin here. And then look at the after. Look how great that looks. This is from the first surgery. And now we're working to make these scars super minimal. And then, of course, going down below, we did a lot of liposuction, internal heating with Renuvion to really give her this well-defined, almost no waist. I mean, it looks amazing. And then you can't quite appreciate it, so I'm going to show you a photo of her backside. We were able to also do a light of liposuction up below to give her a nice, smoother contour to her lower back. We were also able to do Selfina to her buttocks to help with a little bit of the dimpling. Go in there and cut the dimpling, fat grafting to just give her an overall smoother appearance. And then we did the full thigh lift, where we went ahead and smoothed out the front and backs of her thighs. I'll show you a little bit of her before, but you guys are able to appreciate her after now, even though she's laying down. Look at this. And we just got done with the surgery, so she still has a little bit of swelling, but look how nicely this looks. There's no more lumps and bumps that's going on, as you can see in her before photos. Everything is nice and smooth. All the irregularities are gone. And remember, she's still swollen. So this is only going to get better with time with her IV therapy, lymphatic massages, hyperbaric oxygen. And then she's doing her scar treatment. You can see right now her incisions are healing beautifully right now. Part of them are covered up, but look at this. It's going to be really nice excisions, and even these are going to be more minimal, because starting at 3 weeks, we're going to do Fraxel and V-beam, and before we even do that, she's going to do her scar treatment, Silogen, anti-age, refit face to those areas to get the scar to be super minimal. And then remember down below, during her first surgery, we went ahead and did some fat grafting to her posterior calves to give her a nice, more definition, athletic look. Give her a little bit of V-tapering down there to her calves. Helps give her more definition. And remember, I always tell my clients this is only going to get better. So if you guys have any questions, you know how to get in touch with us. You can slide in the DMs, first name, last name, email address, and phone number. We will reach out to you and help you accomplish any goals you may have. Whether you want a counter six-pack or you just want a more well-defined look, we're here to help you from A to Z, from the very surgery to the aftercare to even after that. Now guys, until next time, it's Nisha the PA at Dr. Emer's office. I'll see you guys then. Bye guys.